morning to everyone from London, and welcome to the World Hepatitis Alliance's three-part webinar series called Tools for Change. Today we'll be addressing the global health sector strategy for viral hepatitis. My name is Lazarus, and as Chrissy mentioned, I'll be chairing the session. And before I introduce the three panelists, let me say a few things about how this session is going to work. We're going to have two question and answer sessions, and as you'll see in your webinar control panel, you can send in questions throughout the session, and then I'll be moderating them through our dedicated Q&A sessions. You can also send in questions via Twitter. Those of you on Twitter know the World Hepatitis Alliance's handle. It's @HEP_Alliance. Also, we'll be having two polls throughout the webinar. So you'll be signaled on the screen where we'll be posing a question to you. And when about half or to 75% of you have responded, we'll give you some real-time responses. And we hope to inform our discussions a little bit. So now our three panelists. Well, I'm thrilled to have Raquel Peck, the CEO of the World Hepatitis Alliance, with us, and Bisi Bright, dialing in from Nigeria. Bisi is the CEO of LiveWell Initiative in Nigeria. And calling in from Geneva is Dr. Stefan, Wiktor, the team lead of the Global Hepatitis Program at the World Health Organization. So our agenda for today is, first, Raquel will be talking about how to use policy documents to drive national change. Bisi will then be presenting a case study as a member organization of the World Hepatitis Alliance. And thirdly, Stefan Wiktor will be talking about the World Health Organization's global health sector strategy for viral hepatitis, which, as we know, is a key policy document for all of us. So let me now hand over to Raquel, how to use policy documents to drive national change. Raquel.
Thanks, Jeff. I just wanted to start by saying that the reason why we're doing this webinar is because we were had the opportunity to speak to a couple of our members and also other NGOs and organizations out there, and we realized there was a lack of awareness when it came to policy documents that could really help them with their advocacy work. And by policy documents, I'm talking about UN resolutions, like, for instance, WHO resolutions, but also declarations and manifestos that come out of meetings, and even, to a certain extent, the Sustainable Development Goals. So if we were to take the declarations, for example, and here's a picture of one that I can think of, the most recent one. That's the Glasgow Declaration for viral hepatitis, and it emerged from our World Hepatitis Summit last year. And what's great about it is that it was signed by an array of stakeholders, and you could really use this declaration to effect change and get put pressure on governments. And also, if you're, for any reason, not one of the signatories, you could then perhaps find out who the signatories were and start partnerships. Also, regarding resolutions, WHO resolutions, we are very lucky in hepatitis because we have two resolutions. And again, talking about ways to use those policy documents, I'm just going to mention the 2014 resolution. There's a clause in there that says that governments should promote the involvement of civil society in all aspects preventing, diagnosing, and treating viral hepatitis, which essentially means that governments agreed to consult with civil society. So in practice, what it means is that if you're an NGO in your country and you know that your government is putting out awareness campaigns or developing strategies and you haven't been informed or consulted, take this document to them and start a dialogue, because they've agreed to the fact that you are important and you should be involved. Lastly, I wanted to talk very briefly about the Sustainable Development Goals, because for the first time now, hepatitis has a mention, and that's very important. That really means that within global health, we are a priority. And again, it's another document that we could use to help with our advocacy work. And just before I finish, really, I just wanted to mention the global strategy, which carries the title of the webinar. And really, in terms of policy documents, we really believe that this one, if adopted, could be the game changer for hepatitis. I'm not going to talk too much about it because I know that Stefan is going to be mentioning it later, but I just wanted for now to highlight the importance of the document and perhaps we stop here and then we can continue the discussion.
Thanks, Raquel. Before I move on to Bisi, we're going to have a poll. But before I actually move on to that poll, since we have a picture here of the SDGs, and I see SDG 3, which deals with health issues, I was just wondering if you had a comment. It's an interesting SDG because it calls for ending HIV and TB, but it calls for combating hepatitis. How do you understand the wording? What does it mean to combat hepatitis? And does the Alliance actually have a different vision than just combating it?
Completely different. I mean, we actually lobbied really heavy to get this change to ending hepatitis. We can end hepatitis, and that's why we have an elimination document about to be adopted, hopefully in May. And it was a bit of a disappointment, but in fairness, when we were looking at the process of the SDGs, there was a fight between, I think, all other health issues wanting to have a mention. And I think that the single fact that we are there is already really important because we were not mentioned in the Millennium Development Goals. Really forgotten. So at least that gives us a tool to push for change. But I have to agree with you, Jeff, completely. I mean, it should be end hepatitis for sure.
Thanks, Raquel. Yeah, there's been a lot of discussion. I mean, there's a huge success in moving from the Millennium Development Goals to the Sustainable Development Goals and getting hepatitis clearly mentioned. But now already the powers that be are pushing things more towards elimination with a Hep B vaccine, with an effective Hep C cure. So let me now advance us to our poll. And the question to everyone in the audience from around the world is, have you ever used policy documents in your national advocacy activities? You can just click on yes or no. I'll give you a few minutes to think about that. There's different kinds of policy documents. They could be national, international, even more at a local level. But have you used them in your actual advocacy activities? Okay, so I'm seeing the first results in, and it's actually 67% have said yes, and a third have said no. Hopefully you can all see this on your screen. So this is interesting, and during the Q&A we can talk about this. For the 2/3 of you who have said yes, what kinds of documents, how did you use them? And for the third that said no, well, why not? I'm sure there's a lot of interesting reasons from your particular context. So we'd like to hear why not and how the World Hepatitis Alliance, WHO, and others might help you use those kinds of policy documents in your advocacy work. So let me advance us to Bisi Bright. Bisi is calling in, like I said, from Nigeria, from the LiveWell initiative, and she'll be presenting a brief case study on their work in Nigeria. Bisi, over to you.
Thank you, Jeff. Hello, everyone. I think I'd like, I need someone to help me do the slides, please.
Okay, I'll do the slides for you.
Okay, yes, please. I'll appreciate that. Thank you. We've found that from statistics, 1 in every 12 Nigerians have been found to have hepatitis or are living with hepatitis. And it's been found that among these populations, it's very palpable because people don't even want to agree that there is anything called hepatitis in Nigeria. And so the federal government came out with a policy, a draft policy just last year. And based on the 2010 resolution, the World Health Assembly resolution on hepatitis, the LiveWell initiative convened a strategic focus group discussion in 2013. And the meeting actually involved a lot of high-level policymakers and civil society. We brought in organizations from the private sector and government, and we actually appointed the Honorable Permanent Secretary Health in Lagos State to head that committee. And the major outcomes we had were quite palpable, because at the end of that strategic focus group discussion, we released a communique which actually called for action on hepatitis, awareness, screening, and treatment. And we were so lucky that it had impact, because soon after that, the Lagos State government convened a viral hepatitis committee. At the federal level, we also had the benefit of a visiting professor from the U.S. who dialogued with government, and we were also involved at our own level, at the civil society level, and we had the opportunity to meet with government officials. And though we do not claim the success for that directly, this high-level official from the U.S. was able to get an inroad, penetrate even at the federal level. And so both at the local and national level, we found out that a draft of the viral hepatitis policy was actually eventually put in place, and the federal government has actually also put in place a technical working group. And to show that this has been palpable and result-oriented, the technical working group put in place by the federal government to operationalize the hepatitis policy actually met last week in Lagos for the first time, and the National Coalition of the Network of Viral Hepatitis CSOs in Nigeria, led by the coordinator, attended the CWG. Although the major outcome we've seen in that is that we need more work with the World Hepatitis Alliance members to be recognized within this technical working group, and then as a body in Nigeria to be more, to have more coalition. And so as a result of the 2010 meeting, which we had, starting at the beginning of the road with that, we found that we have been able to impact policy and to lead to positive changes in the hepatitis management in Nigeria. Thank you.
That's great, Bisi, and thank you for mentioning. We are, as the Alliance, we're happy to help advance things and support your efforts. I just have a quick question. When you mentioned that you used the 2010 resolution to speak to the government and get their commitment, I wondered if what was the process? Did you send letters to them, and when you managed to speak to them, were they already committed, or did you need to do a little bit more work to get them fully committed?
Yes, thank you, Raquel. You find out that when you're working with government, you don't have to, first of all, you need to be very diplomatic, you need to be very patient, and you need to be close to the government offices. So we did have a close relationship, especially with the Lagos State government. The Honorable Permanent Secretary Health at the time, I really don't want to mention him, he was very, very empathetic towards our cause, and he did cooperate very well with us. And he actually chaired that committee, and so he ran with the dream, and that really helped us. So one lesson we've learned is that you really need to carry government along in what you're doing. And of course, we went through the proper means. We wrote to them, but we didn't just send a letter without following up. And prior to our writing, we had gone there to talk to them about it, followed up with a letter, and then followed up after the letter, and got a very high-powered committee put in place, which government also felt happy to chair, because we had some very top private sector organizations and, of course, tertiary health institutions and so. So the stakeholders were carefully selected, and we carried government along, and we did write letters. Yes, we did, but we followed up. Thank you.
Great. Thank you, Bisi. Thanks.
Thank you, Bisi.
Thank you, Raquel.
Just a reminder to everyone out there, please do type in your questions into the question section in your meeting control panel. Let me take one that just came in to Raquel. And it says, what will the Alliance be doing this year to support members' national activities, including, the use of policy documents in their work?
So, we have a series. We have a very actually ambitious strategic plan about to be launched. So I'm not going to get into much detail, but more specifically on this question. There's this webinar, and out of this webinar, we're going to have like a hub with tools, and also highlighting all of those documents. So hopefully, all these discussions that we are having here, you're going to have access to the documents that we're mentioning, the clauses that can be very important. And by any means, contact the team in London, and we can help you if you have any questions. That's why I was asking the question to Bisi as well. As sometimes you have the document in front of you, but you're not quite sure what the best approach with your government would be. Is it going to be writing a letter to them? And if so, if you need help with that, we can help you in terms of providing with a template, etc. So there are many ways that the Alliance can be helping you at a national level. But I think that the most important message is to remind you that we will have a capacity building hub with all of this information that I'll be discussing here.
Thanks, Raquel. Just remind us, so the Alliance was formed about 10 years ago, and before, when you were formed, there actually were no major global documents about hepatitis, is that right?
There was nothing. There was nothing.
There was pre-resolution,
there was no resolution. And in fact, it's great that we have Stefan and Wiktor sitting here with us today, but when we were formed, there was not even, not that there wasn't even a global hepatitis program, there was not one person within WHO whose job title had the word hepatitis in it. Really, we looked. Out of the 8,000 people out there in WHO, there was not one person dedicated to hepatitis. So now it's fantastic. We have a team, we have resolutions, and we've came very far. It's really exciting.
Great. Thank you. As we know, it's made such a difference to have a team at WHO, but also to have the Alliance pushing for the resolutions and pushing for these high-level documents. One last question before we move to Dr. Wiktor. It came in from Twitter, and it says, Raquel, how do you successfully involve stakeholders to fight hepatitis? So how do you use different kinds of stakeholders besides?
Well, we really believe that this is not a fight that we can win alone. It's not only about civil society and NGOs shouting. I think this is really, if you're talking about eliminating hepatitis B and C, if you look at the prevalence and mortality, all these rates, and even the level of awareness, we need all the stakeholders. We need the medical societies, we need WHO and partners. So it's an effort from all fronts. And we as an Alliance, we really try to foster those partnerships, and even the partnerships within our member organizations. So for instance, another thing, very briefly to mention that we are in official relations with WHO. And what it means is that our members, so NGOs in different countries, are de facto in official relationships with their national WHO offices. So you can use that and then perhaps partner with the medical societies, etc. as well, because again, I think it's a big fight. If we are
And when you say medical societies, we're not just referring to the hepatologists. What are some of the other groups that you've been engaging with, or suggest that at national levels, patient organizations and others engage with?
So I think it really depends. We at an international level have a partner with, for instance, the IAPO Alliance and others. But I think it would depend on the context of your country and what activities are taking place in your country. But one thing that we do advise is because we can learn from each other. So partnerships can be very important.
Bisi, do you have anything to add? Some of the key stakeholders you're working with, or different kinds of medical societies or others?
Yes, thank you. Thank you, Jeff. The key stakeholders, of course, the World Hepatitis Alliance has been a very supportive apex key stakeholder. And they really kind of try to rally the CSOs within Africa. And of recent, there was a meeting in Dakar where the CSOs rallied together to work on hepatitis. But we find out that what the WHA is doing, we as CSOs need to put in much more effort to support what the WHO is doing. And really, I think the way it works in Africa, the African hepatitis, viral hepatitis network would also be really pleased to see WHO do something fully owned by itself within the African continent to help to lead the others. But the major key stakeholders, the hepatitis dream, that's the hepatitis cause, wiping out viral hepatitis, is a cause that many key stakeholders are racing with now, and we see it as something that will truly be wiped out by the year 2030. In Nigeria, for example, there is a very formidable group going on, and right now the second strategic focus group discussion is about to be convened. We are actually aiming at a very high target of convening the next strategic focus group discussion within the next 2 weeks to a month. And so, and of course, we will work with government. So it's a cause that will be achievable, but we need to facilitate more entry into the coalition by CSOs instead of a proliferated thing where every CSO is doing its own thing. The coalition needs to be more formidable and fortified. So the major resource we need is a human resource to help CSOs to build the awareness and advocacy program. And I'm sure we will get there very soon. Thank you.
Great, thank you, Bisi. And I know that some medical societies have been very helpful working with and even helping to set up patient organizations. Very much so the hepatology and hepatitis societies, sometimes even GPs here in Europe, addiction specialists and others, because they see the important value of patient groups, and they also see how hepatitis, both the hepatitis B vaccine and now the advent of the new effective hep C cure is moving into their areas of work. That's one of the big challenges we face now is engaging with different kinds of medical societies. So let me turn now to our third speaker, Dr. Stefan Wiktor from the World Health Organization, and he'll be addressing what is the global health sector strategy that we've been hearing so much about for viral hepatitis. Over to you, Stefan.
Great. Thanks, Jeff, and thanks to the other speakers for sort of setting the scene for what I'm going to say. The Sustainable Development Goals have already been mentioned. I just wanted to re-emphasize how important they are. We saw with the Millennium Development Goals, which were initiated in 2000, what an impact they had on HIV mortality, TB, and malaria, which really came down because of massive investment. So we think that it's very significant that these very broad goals, there's 17 of them, that cover the whole spectrum of development priorities. There's one health goal compared to the 3 health goals for the Millennium Development Goals. But it does mention specifically hepatitis. And what combating means it's a bit vague, but we're taking it and running with it and really moving it to elimination. So that's what I wanted to briefly describe is our strategy and how it's positioning with the other movement. So we've developed really for the last year, have been working on this strategy, have consulted experts, have had a series of consultations throughout different regions of the world, and presented at the executive board last month. So the vision of the strategy, and this is the first ever global strategy on hepatitis. There's a number of strategies on tuberculosis and a lot of other diseases, but this is the first one. So it's a significant step, we feel. And so the vision, as you can see, it's broad and it's very ambitious. A world where viral hepatitis transmission is stopped and everyone has access to safe, affordable, and effective treatment and care, as well as prevention. We have a goal to eliminate hepatitis. Now, there's a lot of interpretations of what eliminate means, and I'll talk about that in a moment. But it's important that we position the response to hepatitis as a broad in the context of universal health coverage. Really, the Sustainable Development Goals are meant to be promoting this concept of everyone having access to health, and at a rate at a price that's not going to bankrupt them. So that's the context. And in fact, to respond to hepatitis, you have to be doing it through a variety of activities that are part of the health system. So we're positioning this comparable to what we see for HIV, TB, malaria, all of which have strategies that are positioned around the elimination type of language. And it usually means 90 to 95% reduction in the rate of new infections and comparable decline in mortality. So our goals are the following. We think that in the next 15 years, we can reduce the incidence, so that's the number of new cases of hepatitis B and C, by 90%. So we estimate there's between 6 and 10 million infections currently, and by 2030, this should be below 1 million, at 900,000. For mortality, you want to go from a current rate of 1.4 million deaths to less than 500,000. So this is not elimination in the sense of the disease is gone, but it's a concept of elimination as a reduction of hepatitis, elimination of hepatitis as a global public health problem. To do this, we need to, yes.
I'm just going to interrupt because a question came in for Raquel asking if the World Hepatitis Alliance thinks these are realistic and achievable goals. Maybe we can also ask Bisi if she has a comment on that, but I don't know if Raquel or Bisi wants to comment on these goals, and we can also give the audience a moment to reflect on them. It's a very crowded and complicated graph, and people understand elimination. There's epidemiological elimination, and then there's the elimination as set out here with the 90% reduction. So I don't know, Raquel, is this how the Alliance is this understanding elimination? Is this the kind of goal that you're setting as well for 2030?
For 2030, yeah, I mean, our vision really, we want hepatitis eradicated. Oh, I said the eradicated word. No, but we want it gone. But realistically speaking, the elimination goal is great. We've heard comments here and there about how ambitious those targets were, but really, as Stefan mentioned, and as we mentioned earlier as well around the SDGs and hepatitis being left behind and being neglected, there's so much catching up to do that if we don't have ambitious goals, we won't have the drive to really move things fast. We really are now in catching up mode. So we really need those ambitious targets there. So I think it's very important that we as community, as civil society, we really work hard to talk to our governments and maintain those goals as they are, so they are adopted as Stefan made.
Okay, fantastic. Thank you. Sorry, Stefan, please continue.
Yeah, I think, that's a key question, whether they're achievable, and I think it's key important that we set goals that are ambitious but are achievable. And we know the big advantage that we have is that we have effective interventions to prevent infections and deaths. So we know what to do. We just have to do it at the right scale. And so these are the interventions that we are prioritizing. So hepatitis B vaccination among all children, including a birth dose. Safe injection practices and safe blood, because this continues to be, unsafe injection continues to be a major source of infection in some parts of the world, especially for hepatitis C. We know that injecting drug use is a major route of transmission, particularly in places like in Europe, in North America, and we can prevent these transmissions through implementing effective harm reduction. This means provision of sterile injection equipment, along with opiate substitution therapy and a whole package of interventions to promote safe injection and reduce drug use. Safe sex, particularly for hepatitis B, through condom promotion, and then to reduce deaths we're promoting hepatitis B treatment and hepatitis B cure. Sort of what's under, yes, sure.
Sorry to interrupt, but I have a quick question because these are like the global key interventions. I just wonder, just to bringing back to a national level and taking advantage that Bisi is here on the line. Very briefly, Bisi, all these interventions, can you see Nigeria, for instance, signing up to that?
I can't really speak for government, but there's a lot of work going on already in Nigeria. There's a lot of work going on in the area of advocacy and actually in the area of screening and treatment. And I'm absolutely convinced that I'm not a proxy for government, but I'm convinced that government will support and buy into this because the government is really keen. Like I explained earlier on, we've had very close contact with the policymakers and the people in government that are in charge of the hepatitis policy. We are already talking to them, and they are very passionate about this. And everything that Stefan has talked about so far, I really see the Nigerian government leading Africa in the cause against hepatitis. Although I'm not a government official, but from what I've seen, I'm convinced that the Nigerian government will lead the way because we are working with them already, and we can see that there's a lot of passion with which this is being pursued. And the government also says that it will be wiped out by 2030.
So, Bisi, maybe a very concrete question then. How are harm reduction services in Nigeria? Do you have needle and syringe exchange programs?
Are you talking of the screening services? Sorry, I didn't get that quite well.
I was asking about harm reduction services. I know how they are in Europe and Asia and North America, but how are they in Nigeria? In the capital, do you have the provision of clean needles and syringes for injectors?
Sorry, I didn't get. Were you asking about the laboratory services? I'm really sorry, I just didn't get the word you used.
So I'll come back to that after. I'll come back to that after.
But if it's the laboratory services, we do have virology laboratories in Nigeria. I think there are about 4 of them now. So when you talk of the testing and screening, the patients are usually sent for a confirmatory diagnosis in the virology laboratory, where they also now run a viral load count, and that then determines what mode of treatment, what the next step should be. But I'm not sure if I got your question well. I hope I answered it. Thank you.
Okay, thank you. We'll come back to that issue in the broader question and answers. And a lot of questions and questions, not answers. A lot of questions have been coming through. Thank you to everyone. And let me turn back to Stefan to continue.
Thanks. So I think we're glad to hear we also hear of the encouraging news from Nigeria, and that's one of the countries we're going to be prioritizing to work with so that we can really promote what's happening there as an example to other countries. So I think, we know that we have great treatments now. Hep C you can cure, and Hep B you can control. And so it's we have to scale these up, and that's going to require a significant increase in testing. So I think Bisi has mentioned some of the laboratory capacity issues, but that's an area that will really need to be scaled up. So right now, the strategy was endorsed by WHO's executive board. This is the governing body of WHO, the smaller one that decides the agendas. And so it was endorsed, really broadly endorsed by many countries. Some of the questions came up about the ambitiousness of the targets, but no real resistance. So this will be discussed in May at the World Health Assembly, and that's where we hope it'll be adopted. So this is where Alliance members can play a role. I think that what we need is these are member states, these are countries, representatives from ministries of health come to the World Health Assembly and say whether they're in favor or not of something. So if they hear from their constituencies that this is an important priority, then I think this will help it to be endorsed. We fully anticipate that it will be adopted at the World Health Assembly, And so then the next step will be turning into action. And our strategy will be to work with countries to help, for example, Nigeria, to help them develop national plans that will address all those interventions that I mentioned. And then so the WHO really is hoping to play a key role in providing global leadership, but also country-level technical assistance to make this strategy a reality. Thank you.
Thanks, and Stefan, I just wanted to pick on what you said about the alliance, members having a role in this, because we really think that this document is absolutely brilliant. It is, in our view, the single most important document for hepatitis. We're talking about elimination, there's targets, but we are very optimistic. But I think that we need to really just be very happy at the assembly when it is officially adopted. It hasn't been yet. So just to recap on what you said, we still have to keep the pressure up till it is adopted. And the alliance will be, for instance, preparing documents and template letters for our members. So we're going to be contacting you all because we think that really we need to work with the government to make sure the commitments are high, they're kept at a high level, and that we get this elimination strategy adopted after all.
Yes, thanks.
So Raquel,
and I just want to support. Oh, okay. I wanted to support what Raquel said. I know that the World Hepatitis Alliance has sent out letters to honorable ministers of health in different countries to make sure that this is brought up at the World Health Assembly in May this year. And we all that are working in the area of hepatitis are very hopeful that the WHO will be able to do something about it. And thank you to Stefan for saying that, yes, something will be done and you're doing something with the Nigerian government. We're really happy to hear that. And the enthusiasm is very great in the country and very great in the whole of Africa to wipe out hepatitis, and I'm sure we will succeed. Thank you.
So Raquel, since Stefan did mention the role of the Alliance, we have about 90 days until the World Health Assembly. Are you feeling the pressure? And is there a plan to engage with the key countries that you need to get this kind of strategy approved?
Definitely. I mean, we are already doing that. So we are engaging with a couple of countries that we already know that have an interest. For instance, Brazil is one of them, and they led on the 2 resolutions that we've mentioned earlier, but as well as others. At the same time, trying to see if there are countries that could potentially oppose it for some reason, and then try to do some work there, and working with WHO as well. We thought that perhaps China and Russia weren't going to be too happy about it because of the goals, but we are working with the groups there as well. So I guess our role really, as I said, that 90 days and counting, is to keep the pressure up, to work with those governments, with our members, because we can, at an international level, be sending letters to them and contacting them, but it's very important that they get that, the message from the NGOs on the ground. I think if we can hit them from all angles, our success rates are higher. So this is what we're doing, really.
Okay, thank you. So a question just came in. Well, it's prefaced by saying nice job to the panelists. I think we might have lost Bisi temporarily, but I'll pass that on to Raquel and Stefan. And it says, in the context of universal health coverage, how do we prioritize viral hepatitis interventions? And I think that's a really important question, because here we are very focused in the hepatitis program at WHO, in the World Hepatitis Alliance, at my own place of work at the WHO Collaborating Center on HIV and hepatitis at the University of Copenhagen. But there is a bigger issue going on, which is universal health coverage. And of course, there's an even bigger issue going on, which is the Sustainable Development Goals that you both mentioned, where health is really, concentrated in on SDG 3 and hepatitis even on SDG 3.3. So in the context of UHC, Stefan, how do we push for hepatitis? How is it being positioned?
Well, I think that's a great question, and it's a challenge. Especially for our program, which is a disease-specific program. I think what's important is, first of all, for everyone to be aware of this move, this general move in health towards promoting universal health coverage and what we call horizontal approaches rather than disease-specific. So when we speak to our policymakers or political leaders, we should, instead of just saying hepatitis is important, we should say that addressing hepatitis or that strengthening health systems will help prevent hepatitis infections and death, and vice versa. And then focusing on hepatitis will strengthen health systems. So I think we're ourselves struggling sort of how to really articulate that in a clear way that is real, and but still maintains the visibility of the hepatitis-specific intervention. So I think just for everyone to understand that the era of disease-specific programs is really over. And I think no one is really seeing, including us, we'd love to have a huge investment in hepatitis, but we really don't expect it happening. And I think if there's any increase in health-related investment, it's going to be for this health system strengthening. So then within and all of us have to just within that reality find key messages to get across, and that's what I think we all need to work on.
Can I just emphasize, because that's very, very important what you said, Stefan, and from our side on civil society, what we've been doing is exactly that. So we've been saying to governments that because hepatitis, if you're going to properly tackle it, it deals with immunization, blood safety, injection safety, maternal health. It crosses over so many areas that our argument is by tackling hepatitis, you'll be automatically strengthening your health system. So we are kind of doing a bit of the opposite, but it's exactly what you said.
And it was interesting, both Raquel and Stefan at the World Hepatitis Summit last year in Glasgow, that it wasn't just the WHO hepatitis team that was there, but it was the whole health systems unit in full force engaging. And I remember a colleague said, to someone, well, what are you doing here? And they said, well, hepatitis is a health systems issue. And I know this sounds a little like la-la, but I mean, it was really exciting that we're not just meeting in our disease-specific areas. And Raquel, you mentioned a couple areas, but of course, all of the other infectious diseases, particularly HIV, get strengthened as we dig into HIV and hepatitis. So there's a question about setting up, or it says, can we set up an internet-based thing that works in some countries for World Hepatitis Alliance members to use and learn from? And I know there's different databases, and I know also the World Hepatitis Alliance website has a lot of material. But Raquel, what kind of materials are there for Alliance members, and are they also available for non-members?
In terms of policy?
So it says here things that worked. So I assume best practices or different experiences, case studies.
Right. So we've never had it all together. We're launching it later this year, but this is exactly what we've been hearing. And as you mentioned, the summit last year was a great opportunity to bring our members together and get a feedback. And following that, we are now putting together that capacity building hub where we will have all of those documents and case studies so members can learn from each other. That's why also we brought in Bisi today in this webinar to hear. It's not only about me talking about global perspective, but really a member on the ground in Nigeria and how they felt and their experience about using the 2010 resolution. So all of that you'll be able to find in our capacity building hub, which is coming later this year. But in the meantime, if you need, contact our team. If you need help, contact our team in London, because I don't want you to be waiting till this is launched. Don't wait for it. We are here to help you.
Excellent. Thank you. And there's also regional.
Yes, I just wanted to add something there. You can see we've been having we have this general infrastructure challenge, and it's actually so unpredictable because sometimes it's all the internet solutions that have an issue, and it's something which if we could get a server, maybe the WHA could help the coalition and they have a server or things like that. That would really help. That's why I said the infrastructure challenge and then, of course, capacity. Those are the two major challenges because a lot of CSOs have been screening, doing a lot of advocacy, awareness, and so on. And we can do even much more if enabled. Thank you.
Thank you. Thank you, Bisi. Let me insert a poll here and hear from everyone on the webinar. The question is, will you contact your government ahead of the World Health Assembly to ask them to adopt the global health sector strategy for viral hepatitis? So, well, people are responding extremely quickly. I don't want to give the results before everyone's had a chance to vote. And while you're voting, let me just thank one of the participants who answered an earlier question I had for Bisi in Nigeria about harm reduction programs. Yes. And she wrote in, this participant, simply that at present there are no harm reduction programs, or at least targeting hepatitis in Nigeria. So there's one area of work you have ahead of you, also in alliance with the in step with the actual global strategy. So about half of the votes are in, and here we have our results, which are exactly the same as our last poll, which is 2/3 voting yes and 1/3 no. And of course, we have a variety of participants on the webinar. So some of you aren't necessarily, in position to be able to contact your government, but certainly the organizations and particularly the patient groups can do that. So let's advance and take a few questions from the audience. So I have one here. I'll just read it out. It says, who can promote the catch-up vaccination for those who are not able to get it, either a birth dose or since birth? And it has a second part of the question, which is that is there a WHO statement regarding discrimination related to hepatitis, discrimination in the workplace? So the first question is, who can promote the catch-up vaccination? And the second question is about discrimination in the workplace. Any of our panelists care to comment? Stefan, maybe around the vaccination, I know the strategy, and WHO for a long time has been promoting the birth dose, but if you miss the birth dose, well, who's promoting it? Who's promoting the vaccination? Yeah. Different places around the world.
As you mentioned, the emphasis has been on making sure that children are protected. So vaccination during the first year of life, starting at birth. But I think some countries, particular countries that have very high coverage now, there's some proportion of young adults or adolescents who are not protected, and those countries are on an individual basis deciding to do catch-up vaccination. So there is a WHO policy statement on hepatitis B vaccination that lays out all the different recommendations. In addition to children, there's a number of risk groups that should be vaccinated, and then increasingly this cohort of unvaccinated adolescents or young adults that should be caught up. Now, I think again, alliance members can play an important role in highlighting this problem, advocating for what has to happen is for countries to develop national policies promoting that, and then and invest in it, purchasing the vaccine and so on. I think it's the overall now. I think it's 83% of children are protected as of 2014 data have been vaccinated. So really, it's tremendous success, and we're seeing the impact of it in many countries, particularly in Asia, where the rate of infection has dropped dramatically in children. As for stigma and discrimination, we do highlight that in our various documents. There's not a single policy document that talks about it. We really promote that in our guidelines and every other document, really to highlight the importance of making sure that any health intervention, any policy, that issues around stigma, discrimination are taken into consideration, since really it's a major problem both in countries where, even in countries where it's a general epidemic problem, we know that there's stigma. So it's an ongoing effort to try to address.
And I just wanted to comment just very briefly, because I know we are almost at the end of the webinar, but on the issue of stigma and discrimination, that it really comes and emerges from the fact that there's still very little awareness of hepatitis. So hopefully, that the elimination strategy being adopted, the Alliance will be launching an elimination movement. I won't talk too much about it because we're going to be addressing it in our next webinar. So maybe I'm doing a bit of a promo here. But this is coming as well, and hopefully by raising the level of awareness of people, automatically you would impact on stigma and discrimination, which is still a very a sad reality for patients.
I mean, what we're hearing from both of what you're saying, Raquel and Stefan, and from the question is I mean, the hepatitis issue goes beyond the health sector. I mean, obviously stigma in the workplace is an occupational health issue, but it's not always governed by the Ministry of Health and the health sector itself. And another question came in related to that is, does the global strategy include proposals and linkages to other sectors concretely? And it says here specifically the educational, employment, and industrial sectors. Because you mentioned again, we realize it's a very specific strategy for hepatitis, but you mentioned the importance of a health systems approach. So does the strategy actually mention that or give any guidance on how to do that?
The strategy really, as the name indicates, it's really about the health sector, since that's WHO's domain. So there's mention of it, but it's really the interventions are really, it's really taken from a health sector point of view. I think the number of the Sustainable Development Goals, other than the health goal, have targets in it that are related to health and that could be applied. But I think that's a great point, and we really should be thinking more broadly. It's just that it's really within WHO, health is its primary area of responsibility.
Of course. I mean, there is a lot of talk and a movement now to think laterally. So, for those of us in the health sector focusing on SDG 3, what other SDGs can we link up with? I think that was also some of the thinking behind the SDGs, was to look at the whole development sector as a whole. And one of our big challenges heading in the next couple of years is how are we going to do that? How are we going to get out of our silos a little bit? So we are just about out of time. And let me thank, firstly, everyone who logged on and sent in questions and participated, all our participants from around the world. Thank you very much. We're also going to be having the same webinar this afternoon this evening with another speaker added on, Dr. John Ward from the CDC, heading the viral hepatitis program there. But let me thank our three panelists. Thank you so much, Raquel from the World Hepatitis Alliance, and for the Alliance for organizing this entire Tools for Change series, and everyone on your staff. Thank you, Bisi. I know it was difficult to get online from Nigeria. Thank you so much for
Thank you.
making it.
Thank you very much. It's been a pleasure.
Very much appreciated, and nice to hear the patient perspective. At the front line, really, you have a huge challenge ahead of you. And finally, thank you very much, Stefan. The work your team is doing, is visionary and fantastic. And like you said, this is the first strategy on hepatitis, and we're so thrilled everyone around the world is going to benefit so much. And we have this exciting interim period from the executive board now to the hopeful and assumed adoption coming up, this May, and then a huge task ahead of us, heading into 2030. Both your definition of elimination and the specific targets there, eliminating hepatitis as a public health challenge. Others who have even more ambitious targets of in their context, in their countries and regions of a more epidemiological elimination of no new cases in 2030. So a lot of work ahead of us. Let me tap on to what Raquel said and do a little promo aside from tonight. We don't expect too many of you to come back, but you have a chance now to spread the word that we have the second webinar on this topic, on the global health sector strategy for viral hepatitis. But also on March 10th, we have the second webinar in our series. That's going to look at how we can interpret and leverage survey results for effective advocacy, looking specifically at the HCV Quest Global Patient Survey. There's more information about that on the World Hepatitis Alliance website. And finally, we have a third webinar on Monday, April 4th, as we explore the influence media coverage has on policymakers. So let me wrap up on that note. Thank you, everyone, for logging on, and thank you to the panelists.
Thank you.
Bye.
Thanks.
Thanks, Jeff. Thanks, everyone. Good job.
Thank you. Bye-bye. Thank you.
Bye.